Hello, I'm Christina Graham, and I'm a registered dietitian and certified diabetes care and education specialist at Titus Regional Medical Center. Today, our adult diabetes support group will be exploring the effects of stress on our health and well-being, and some coping techniques that can help us decrease the anxiety, worry, and fear in our lives. Stress has an impact on all areas of our health and well-being, but for people with diabetes, it's important to understand that stress can raise their blood sugar or blood glucose levels. The rise in blood glucose is caused by the effects of the stress hormones called cortisol and adrenaline. Stress can also make it harder to focus on our diabetes care. So under stress, we may eat too much or not enough. We may feel tired and lose our desire to exercise. We may also be more forgetful and thus forget to take important medicines. To help us understand stress and some coping techniques for managing it, I am pleased to introduce Ms. Jennifer Staten. Jennifer is a graduate of the University of Southern Mississippi, where she attained a master's in social work. She is a licensed clinical social worker offering counseling services for people ages 13 and up at Titus Family Care Center on Hartsbluff Road. She is also a member of the Titus Fit Cardiac Rehab Program and the Titus Pain Management Clinic. So thank you for joining me today, Jennifer.
Thank you for having me. Today we're going to look at stress in our health, and we're going to start out with the purpose of today, and that's just to define stress and to understand the components of stress in our life. I want to help you identify the sources of your stress and, of course, discuss the impact the stress is having on your health and then ways you can manage that stress. So stress can be defined as a state of emotional or mental strain or tension resulting from adverse or very demanding circumstances. Stress has physical, mental, or emotional factor that causes us bodily or mental tension or strain. Stress represents the effects of anything that seriously threatens our homeostasis. Our homeostasis is what our baseline is, our normal. So what our normal physical activity, emotional capacity, mental capacity, anything that alters that in any way has threatened our homeostasis. Stress is what we experience when we believe or perceive that we cannot cope with a situation that is threatening or frightening to us. Our stressors can be an actual event or a perceived threat to us. How we individually perceive our stress can be perceived either positive or negative, and it's ultimately what determines our body's response to our stress. What is scary for one person may be the run-of-the-mill experience for another. Stress is so individualized, and it's so important to know what stresses you as an individual. A stressor can, in response, cause a cascade of bodily reactions. I think so commonly we think that we can just say, I'm stressed, and that's the end of it. And we really don't take the time to look back and think about how stress is affecting us on all aspects of our life, both physically, mentally, emotionally, cognitively, and even socially. So stress has effects on us. We understand that stress and how we perceive stress affects us, but often we don't see the direct relation to our overall health. And again, how we perceive stress matters. We all have an individual perception of our stress, and what causes our stress can be different or the same as another person. And how we view our stress can be a positive view or a negative view on us. And that impact it has on us also impacts our body, mind, emotions, which then again all impacts our daily living. So what are your common stressors? As I mentioned, stress is so individualized, and so it's so important to know as an individual what's causing you stress. What are those stressors in your life? Are you aware of what's stressing you? Some of the common stressors that I will hear daily from people are work and finances, grief, loss, health, our individual health, and also the changing health of our loved ones. Moving and change are really big stressors for people. Some people just do not do well with change, so being self-aware of that. There's also tons of social and family stressors that I think sometimes we just overlook. Especially listed at the bottom of this list is holidays. Holidays brought in social and family stressors that at times we're just not mentally prepared to handle. Traffic and travel are big stressors. And then, of course, COVID. The whole world embarked on something that we weren't planning on embarking on, and it's become a very big stressor in all of our lives. And at times, the stress of COVID has been just overwhelming. So, as we experience stress, we have reactions on our body, and those stress reactions can be physical, psychological, or emotional, behavioral, social, and cognitive. Over time, that stress response can accumulate and it begins to compromise our overall health. Our everyday life happenings or events can have an effect on each of us. So, I'm going to look at how stress affects each of these areas of our life. So, starting with physical stress reactions, a physical stress reaction can be an increased heart rate or blood pressure, lack of energy, sweating and chills, upset stomach and nausea, diarrhea, a decreased immune function. And as our immune system is decreased, we have an increased chance of becoming ill. You'll notice muscle tension and twitching, an increased or decreased appetite, and headaches. Psychologically and emotionally, stress can be shown as anxiety or fear. You'll see people who are in denial over the stress that they're experiencing, worry and guilt. Worry is a huge one. Worry and guilt will go hand in hand with your anxiety, and then it just cascades into a whole reaction, and the cycle's really hard for some people to stop. An outward expression emotionally of stress that I see a lot is irritability and anger, restlessness and nervousness, depression, and then emotional and behavioral problems. And what I mean by that is you may see someone who usually on the day-to-day seems to have everything together, and under stress they just may react differently, may just break out and start crying, those sorts of things. Behaviorally and socially, you'll see changes in activity levels. Someone who's usually a very active person may decide that they're not going to be involved in activities any longer. An inability to rest or relax. Someone that overreacts. Someone that's very social may begin to withdraw or isolate from others. Difficulty listening or engaging with others. So you're there, you're in the conversation with someone, but you have no clue what they're saying. You're just so stressed you can't even hear the words that they're saying to you. And a difficulty accepting support or help from others is very common. Cognitively, stress looks like memory problems and forgetfulness, confusion, and a limited attention span and poor concentration. So there's two types of stress that we look at. We have acute stress and chronic stress. Acute stress is an immediate perceived threat. It's either physical, emotional, or psychological. It's very short term. And chronic stress is a prolonged and constant feeling of stress. It can negatively affect your health if it goes untreated or unmanaged. Looking closer at acute stress, it's one of the most common types of stress, and it's the least damaging type. Like I said, it's very short term, very time limited. It's usually manageable. The common physical symptoms of that are the thumping heart, you feel sick to your stomach, chest pain, headaches, abdominal pain. Acute stress is really just that pumped up feeling. It's the type of stress that causes a thrilling and exciting feeling. It's the fight or flight. You know when you experience it, you either have to flee it or you have to confront it. Some common examples of this are sporting competitions, an exam, a work deadline, public speaking. These are all types of acute stress. And again, acute stress is very short term, and it's the least damaging of our stressors. Chronic stress, on the other hand, it goes on for a prolonged time, and it can result in long-term damage to the person. It's grinding stress that wears away at people. The stress system remains activated over a long period of time, and this leads to serious health risk and problems. There's both physical and emotional symptoms to chronic stress, anxiety and depression being big ones, confusion and anger, insomnia and fatigue, muscle tension, pain, chest pain, high blood pressure, and a weakened immune system. The other thing I'd like to mention with chronic stress is with especially the anxiety and the depression and just the ongoing stress, you also look at post-traumatic stress disorder being something that can also come up from this. There's mounting evidence that ongoing stress and poor coping methods, such as smoking and overeating, lack of exercise, poor sleep, will increase a person's risk for heart disease and type 2 diabetes. Examples of chronic stress are financial problems and relationship problems. Our frontline workers are experiencing chronic stress day in and day out. Our military also, an unsatisfying career, and the role of a caregiver. I think so many times caregivers just think it's what they need to be doing, and you don't take into effect that that's a job that never ends, and that the health of the person you're caring for changes over time. And so that is a type of chronic stress. So, as you reflect on what I've discussed regarding the impact of negative stress on our minds, is there something you've identified as needing to do a better job managing? Managing our stress is so important. And just as I've said on and on again through this, that stress is so individualized. The stress itself is individualized, its effects are, but managing our stress is also very individualized. By managing our stress, levels can not only make you feel better right now, but it may protect your health long term. You have to become self-aware of your stress. Identify specifically what is causing you stress. So many times I tell people you have to name it to tame it. And if you can't name your stress, there's no way we can tame it and figure out ways to cope with it. Identify ways to cope with the negative stressors that cannot be avoided. You know, so many times they're just the reality that you're going to be in a stressful situation and it cannot be avoided. And so it's having that just radical acceptance that I have to go through this, but I can control this. And so identifying that would really help lower the stress in a stressful situation. And then setting effective and realistic goals to meet your desired change in your stress management. What do you want that to look like? Having a goal for yourself is very important. So I've listed just some of the basic ways that we can begin to manage our stress. And those are: maintain a healthy diet and aim for a healthy sleep routine of 7 to 8 hours per night. Exercise regularly, and exercise does not have to be just a really intense routine. Even going out on a short walk for 10 to 15 minutes every day really clears the mind and does great things for our stress. Minimize the use of caffeine and alcohol, and stay socially connected so that you can get and give support. We are social beings that require socialization. This past year, our social connection has been tested to the limit, so finding a way that you can safely connect with others is going to be key. Whether that's through a Zoom call or FaceTime or Facebook or email, finding a way you can socially connect. Make time for rest and relaxation or self-care. And self-care for so many are the engaging in those activities that are hobbies, and reading or gardening, playing golf, whatever that looks like for you. Another huge one is learning meditation techniques such as a deep breathing exercise. Deep breathing really helps us focus in on the mindfulness of those meditation techniques and relaxes the body and helps with stress. And I want to look a little further at deep abdominal breathing. So the way we breathe can elicit relaxation in the body. And when we're stressed, breathing tends to be very rapid and shallow, and we're breathing more from the upper chest. And when we're relaxed, our breathing is slowed, and it takes place deeper in the abdominal area. So increasing our awareness of our breathing patterns allows us to consciously slow down and deepen our breathing during times of stress. So Christine's been so kind to agree to go through a deep breathing exercise with y'all today. And so the main thing to remember when you're doing this is that you want to sit or lie in a comfortable position. And you want to put one hand on your belly just below your ribs and the other hand on your chest. And so, Christine, when you take your deep breath in, you're going to take that deep breath in through your nose, and you're going to hold it for about a count of 4. And then when you breathe out, you're going to breathe out through like pursed lips that are almost like a whistle for a count of 7. There you go. Yeah. And so, just as Christine just did, if you will do that about 5 times each time you do it, and usually I tell people do it about twice a day, and it can be really relaxing. It really clears the mind. And the way that this is working is it is causing the person to focus so much on the breathing that the anxious thought or the stressful thoughts begin to fade away and the body relaxes. So again, just putting everything together, it's so important to identify your stressors and know what individually is stressing you, and then think of ways to alleviate your stress. Set goals to lessen that stress, and then overall, just breathe and relax.
Awesome information, Jennifer, and thank you so much. I think of times when people may respond to stress with harmful behaviors. It may be alcohol, cigarettes, caffeine. And so I'm so thankful for the information you're sharing today, because we really do need to find some positive ways to deal with stress. We're at a all-time high level of stress, like you mentioned, with all that's going on right now, and realizing that that can be negative in terms of our health and well-being, but then finding ways to manage and take control. I think what you've shared is so very powerful. So I appreciate you today. So
yes, absolutely.
I would just like to end with a little information about how you can find Jennifer. And again, thank you, Jennifer, for sharing these management steps. Jennifer is located, as I mentioned, at the Family Care Center on Harts Bluff Road, and her number is 903-577-2273, or CARE, 903-577-2273. Jennifer would be happy to help if there's anything that you need that might be in the way of dealing with stress management, but also other issues like depression and other mental conditions. You know, it's important to understand you're not alone, and I'm thankful that we have somebody knowledgeable here at Titus Regional Medical Center that can help. I'd also like to just make sure you remember that we are an ADA-recognized diabetes education program. We teach not only diabetes management steps, but we counsel on stress, sick day management, meal planning, how to eat healthier when dining out, and exercise safely with diabetes. So we have a comprehensive ADA-recognized program, and you can reach us at 903-577-6099 if you have any questions or concerns about your diabetes, or you would be interested in coming to our classes and participating in our program. I thank everybody for joining us today for this Facebook Live, and I do wish you a happy and a very healthy 2021. Have a great day.